I spent the night in the hospital, which was my own choice, but I wanted extra care. I wanted the nurses checking on me. I wanted extra knowledge of how to take care of myself when I got home. Hi, I'm Lisa, and I'm a patient of Dr. Grover. So I chose to be genetically tested because several female relatives of mine have been diagnosed with cancer. So after I finished having children, I told myself I was going to get tested, and I'm so glad I did because they called me and told me I tested positive for the gene mutation that causes breast cancer. So after I found out that I tested positive for the gene mutation, they set me up with a breast oncologist to talk about options. And my options were testing and monitoring for any lumps or problems with my breast for the rest of my life. The other option is surgery, and that's the route I chose to go. I wanted to eliminate the risk right away. I was recommended to a surgeon within the network who I met with, but due to issues in his personal life, he wasn't able to complete my surgery. But he did recommend a surgeon that he had worked with in the past who was really lighthearted and kind and a terrific surgeon, and that's Dr. Grover. And when he first walked in, I was so relieved. He came in like a ball of energy, had all kinds of questions for me. I had all kinds of questions for him. He went over my options for reconstruction, which included a double mastectomy or a lumpectomy if I needed one, which I didn't. So we decided on the implant route. And I asked him a million questions, and he eased my mind. And when I left the appointment, I felt confident in my ability to decide on which surgery I needed, and I felt confident that he was going to be the one to do it. So I showed up for the day of surgery, and I was very nervous, but there was a team of nurses that walked me through everything. They calmed me down. My husband was able to be there. Dr. Grover came in before my surgery, made sure I was okay, brought his sunshine, and he asked me any questions. He made some markings on my body where he would be doing the procedure. And then they took me back and put me under. And my breast surgeon that I chose did the double mastectomy first. And when she was done, Dr. Grover and his team came in and placed expanders and then sutured me back up. And I woke up in the recovery room, and again, another team of nurses. They made me very comfortable. They explained what I went through, what the outcome was. And then Dr. Grover came and checked on me again, and everything looked good. I spent the night in the hospital, which was my own choice, but I wanted extra care. I wanted the nurses checking on me. I wanted extra knowledge of how to take care of myself when I got home. So after the healing was going well, he and his team would fill the expanders with fluid every week until they became a size that I was happy with. And once Dr. Grover felt like the progress was there, we went ahead and did the reconstruction surgery. And that surgery was much, much easier than the mastectomy when you didn't have the pain of the mastectomy. This one was simply removing the expanders and putting the implant in, and a bit of local tissue reconstruction from what I understand. And then it was done. It's just a healing process day by day. Everything got easier, got better looking, the bruising went away, the stitches fell out on their own. I went for a 1-month checkup with Dr. Grover, and he was happy with everything, so here I am. So for any other women going through what I'm going through or thinking about going through what I'm going through, my biggest piece of advice is rally a team around you. There's a tremendous team of nurses and doctors that will be there every step of the way. Dr. Grover was my biggest cheerleader. His team was amazing. They worked on me all summer long. Every time I went into the office, they met me with smiles. The relief that I feel is just life-changing. I don't have to live in fear anymore. I don't have to worry about testing anymore. I look good. I feel healthy. Everything will be okay.